All right, welcome back. It is News Up. So good to know you are there. At this point in time, we will be starting our conversation. We'll be looking at concerns around the health sector. It is no longer news that the National Association of Resident Doctors of Nigeria did kickstart a strike, 12 midnight on Wednesday. And you saw on the front pages of our national dailies the impact has spread across a few hospitals across Nigeria, where patients are being turned back and some are even stranded and all of that. A very huge concern within the health sector. We will be speaking with Prince Bayo Balogun. Honorable Bayo Balogun is a member House of Reps. He's joining us in our Abuja studio. Let's look at the health sector and let's look at possible ways we can avert the breakdown within this sector. So good to have you on the program, Honorable. Good morning.
Yeah, good morning. Good morning.
Yes. We apologize for the slight delay. However, let's look at what this concern have thrown out. You are a member of the House of Representatives, and to a large extent, the organization foresees or looks at the nation from the bigger picture. Here we are looking at resident doctors embarking on an indefinite strike. Now, they are calling for things that are not new to the system. They're calling for better welfare, better service, and all of that. From your perspective as a member of the House of Representatives, what conversations are you having in this regard so far? I mean, this agitation did not start now, or did not start today or yesterday. It's been on for a while. Apparently, we've not been able to deal with the concerns that doctors have raised.
Well, once again, good morning. We have to look at this issue holistically. Like you said, it didn't start today. It's always been there. And that's why the current government wants to have an holistic and long-lasting and robust discussion with all the stakeholders. The House of Reps has actually set up a committee that will be meeting with them today, and it's going to be a continuous discussion until we are able to come with a lasting solution. Most of the time, we've always been having this quick fix approach to issues of labor, but with Ashwaju, is someone who loves having a long-lasting plan. You must have something on ground that would stand the test of time. So I just want to appeal to the doctors. They have to know they have to know how sensitive their job is, and they cannot just afford to start going on strike. Yes, we know it's a bad situation. It's bad for everybody. Every Nigerians are feeling the situation today. It's even different from what we used to have before. We are going through an economic reform, which involves the removal of fuel subsidy, equalization of the forest market. All these are having joint impact on the economy and on everybody. So I want to appeal to them. This is not a good time at all to add issue of health, the suspension of health services. The common man depend on the public health sector. Not everybody can afford the private sector, the private hospitals bill. So please, I want to appeal to them. It's affecting every one of us. Nobody is excluded. Let's go back to the drawing table. Let's go back to the meetings, and we'll look at all issues together. As Nigerians, we all have to make sacrifice. And I want to let the doctors know that it takes the sacrifice of every Nigerian to train a doctor. We know how much a doctor is trained abroad. And in Nigeria, we get trained for almost free. And we also have to look at it from what we also get. I can't get trained for almost free in Nigeria and expect to get the kind of dollars they get in America. So please, this is time for sacrifice for everybody. And like you will see, most of the members in the National Assembly today are new members. Many of them too are surprised to see what they are meeting on ground. Yes, everybody feels it's a very easy job. And that's why you have not been hearing consenting voices outside, because everybody could now feel the impact. With all the new members on board, and nobody is saying, yes, this new government is not trying. With the number of opposition we have on ground, this is the first time we have a potpourri of different parties being in the National Assembly at the same time. We have about 5 or 6 parties this time around, but no party is coming out to say this government is not trying. And that's the reason that that means we are all facing the reality of the economic situation. So what I can just say is just appeal to them. Let's take it easy.
All right,
things will be
Mr.
better.
Balogun.
And what we are trying to do now is to have a permanent solution, which will be better for everyone at the end of the day.
And yes, that permanent solution is what every Nigerian, even the health workers, are looking forward to having in the conversation. As you're given your plea, we do know that the Speaker of the House of Reps did set up a committee to meet with the presidency over this issue, over ways to speak on, deliberate on how we can meet the demands of these health workers. I mean, what should we know about how far the committee has gone with this meeting? Has there been any updates? Has there been any meeting in the first place?
Yeah, they are going to have another meeting today with all the stakeholders involved, including the representatives of the resident doctors. There's going to be another meeting today. You know, when it comes to the National Assembly, especially in the House of Reps, it's always continuous engagement. During the night assembly, when we have most of these problems, you see the Speaker, Right Honorable Bajabi Amila, always having a day-to-day meeting until the matter is resolved. So you continuously get engaged at the end of the day.
You know, government, they say, is a continuum. I know you are not fresh to the House. This issue had been raised in the House in the 9th Assembly, but seemed to have remained unresolved. What the resident doctors are calling for cannot be, are not far-fetched. Let me just highlight a few of the demands here. Now, I said they are demanding payment of skipping arrears and upward review of consolidated medical salary structure. It says in line with full salary restoration to the 2014 value of CONMES. Now, this one is of interest to me as well. It says they want an immediate release of the circular on 1-for-1 replacement. What that means is that for every medical doctor that leaves, there should be an immediate replacement. These things that doctors are asking for are not rocket science. They are not, we don't have to go to the moon to deal with these concerns. Why? I mean, for the singular fact that government is a continuum, yes, we are hoping that this should have been resolved as quickly as possible. This back and forth meeting and consultations, we have been consulting and meeting in the last 3, 4, 5 years on this matter. However, how can we trust? How can the doctors trust this assembly or trust this government that they would probably get some level of results in these deliberations and stakeholders meetings?
Yeah, we have to be very objective, I will tell you. We have various sectors. Yes, health is very important, but I believe food is even more important. It is when you are, when you get a good meal, even your good meal is even part of health. So we have to look at all the sectors holistically, like I said. It's not just about one sector saying this is what I want. It's about every Nigerian. Even in Nigeria today, the health sector are still the highest paid. If you look at the health budget, it's usually the highest, even up to the local government level. In terms of personnel, the medical doctors are still the highest paid in Nigeria and most part of the world. So everybody is important. Nobody should look at their own sector as the only important sector in this country. So it is about money. It is about the finance. So we have to look at what we have and what should go to every sector. We cannot put all the money that we have in health sector and then jettison all other sectors. So everybody has to be on board to look at the situation. So I want to appeal to the health personnel. Look, when you are talking about one-to-one replacement, number one, are there doctors to be replaced when everybody is moving abroad? So when it comes to renegotiation of fee of your salaries, this also got to do with the revenue, available revenue. Thank God we are saving a lot of money now through the removal of fuel subsidy. Before now, all the money we have been budgeting has been coming from loans. And when we are talking about salary increment, making demands, when your budget is about 80% funded by loan, then that means we are not really operating an objective economy. So now that we are freeing a lot of resources, we all have to sit down together now and look at what the government can do. Yes, we look at the quick fix, but we have to look at the long-term effect. Even look at our health sector, are we actually doing the right thing? I'll give you a personal example. In my local government in Bejuleki, I was talking to the medical director recently, because by the time you send many people to the hospital, they tell you they do have the personnel to do this, personnel to do that. And I was talking to them and I asked, how many doctors do you even have in this hospital? And I was told 26, including plus the medical director making 27. And I said, 27 doctors in this hospital? Doing what? And yet we could not get services as required by the people. So these are a lot of problems. So we have to sit down with the medical directors. You have to reorganize your personnel in terms of the training, additional training you need to give them to do some of the jobs they are not able to do for now. So you cannot have maybe 10 people in an area that are not actually performing, where some areas are actually suffering. We realize that they do have more of surgeons. So why can't you train most of these other doctors that you have to get into this area of surgery, instead of us transferring people from Ibejuleki to Lagos Island? So these are other issues. There are other things that they even need to do within the health sectors. It's not about just putting more people. We have some hospitals that have over-bloated personnel, where some other hospitals do not have. Some people will say, oh, this is a rural area, we don't want to go to the rural areas. This urban area, everybody wants to go to the urban areas. So these are other areas that does not have to do with the federal government, but the management of the hospital themselves. So we have to also even look at what they are even getting. What are the hospitals getting? What is the allocation going to health? Is it actually being managed well? Is it just about money, or the management of the money going to all these sectors? So that's why we said everybody have to take it easy now. Let's review situation, and let's even work more on our economy. How can our revenue come up? They say economic institutions, structures, other social institutions. You can only give what you get, what you have. You cannot give what you don't have. Some civil servants are getting probably 10% of what the medical personnel are getting. You have the admin officers, even in the hospitals. So please, I want to appeal again to them. We are working on this. It takes every one of us to do this. It takes the sacrifice of every one of us to do it. If you go on strike, you don't know if your daughter or your son or your parent will be needing this medical service somewhere else, apart from your own hospital.
All right, Mr. Balogun.
So
all you said have been totally heard. But while you were speaking, I wondered if you probably have heard directly from the doctors. So every Tuesday we do have doctors, come to the studio to, talk about health issues, and we also ask them how they're faring. And the comments that we get from them, sincerely speaking, is absolutely not fantastic. Where there are some necessary equipment that should be in the hospital, but they are not there. And so you have doctors ready to work with equipment to work to save lives are actually not there. Now, the budgetary allocation for the health sector is a totally
Excuse me.
different thing. And if you did the breakdown, I think it was 2 years ago or last year,
You
each
go and
person,
do your
for
search.
each Nigerian, the allocation for each
It's not just
Nigerian's
about
health.
the doctors saying
On the budget.
we don't have this,
I'm
we don't have
about
that.
to land,
They
please.
have the management.
I'm about to land, please, if you don't mind. So it looks like people at the helms of affairs are looking at the situation this way. Nigerians who actually go to the hospital and people who are actually working at the hospital, the doctors, the nurses, actually seeing it from a different perspective. There is a need for a balance there, because it looks like we're not seeing it from the same perspective.
That is why I'm saying we all have to look at these issues together. Now, look at the budget. Look at what they've been getting. And are they actually managing what they get well? Look, it's not just for every one of us to say we are not getting enough. How do we manage what we get? Let me give you an example. A situation where you go to an office with all the salaries, you pay your clerical officer, your secretary, and at the end of the day, they say, we could not type the letter because we don't have papers. And you ask yourself, how much is the cost of paper to all the other allowances that are being paid in this office? So if you have to actually rationalize and look at what we have and what we're supposed to do, please, let's have an holistic approach to this matter. That's what I'm just saying. Let's everybody pick up, you yourself as journalists, pick up the budget. Look at how much is going to X sector in Nigeria. Let's leave aside the percentage. If Nigeria is budgeting 13 trillion naira and probably over 500 billion is going to health sector, then you now look at the percentage and look at what other sectors should be getting. So that is when you can say if enough is being put into health sector or not. Then review what they've also been getting and if they've been spending this money judiciously. So everybody has to account for whatever they get. It's not just to tell the government that we are not getting enough. It's a sacrifice we all have to make. Health sector is still the highest funded sector. With what is going in there, is the public getting value for the money? So I'm not saying we have done enough. We have not even done enough in any sector. All the roads are bad. Electricity is a problem. So that's why we said, let's give ourselves some few more time. We are going to restructure so many other areas that is going to impact on the way we spend our money. In your regular expenditure at home, what goes into electricity at home now? People spend on generator and diesels. By the time this government fix our electricity, everybody will be relieved. In fact, even the pressure we have on petrol, purchase of petrol today, is actually the ones that goes into the running of generators at home. So the average income of a Nigerian, the way we spend it, will actually be restructured by the time area of electricity alone is fixed. So let's just give us some time. We just need to restructure what we have on ground. It's not just about money. Everything is just not about throwing money to a problem. Let's look at this problem and let's all sit down and see what we can do. Let's see what they are not doing well in the hospital. Let's see where they have to prioritize. So it's not just for the government. Every hospital has its own management team. Let the management team look into what they are getting and how to prioritize their expenditure. Sometimes it's heartbroken when we go to an hospital and they tell you they do have some basic equipment. And you look at it, how much does that equipment cost? And you find out that maybe what they are talking about is not even more than 100 or 200,000 naira. And you look at, if this is what is disturbing you, and you have probably 20, 30, 40 medical doctors collecting money, drawing salaries, and you don't have this little equipment, please, for God's sake, then we have to do something about the whole system. It's not just about blaming government. We are part of the government. Once you release the money for the medical sector, the governor or the president does not get involved again. It's the responsibility of the medical director to run his own hospital and prioritize his needs. So, but at the end of the day, we still come back to the issue of appealing to ourselves. The populists outside there are the ones suffering. It's not about I'm right or I'm wrong. Please, medical doctors, please go back to your hospitals, do the job that you are trained to do, save lives. And I believe it's part of the oath you have taken, that you not let anybody die if you can help the situation. I'm appealing to you once again. Please go back.
I'm very sure that the medical doctors, the resident doctors are listening to you right about now. And the entire Nigeria is equally listening to you right now. But I'm sure a majority of them would also be asking the same question. You talked about prioritizing. You talked about the fact that they should be patient and all of that. And many Nigerians would wish that this will be the case across board when it comes to issues of monies and allocation, that everyone, there could be, that allocations will be prioritized. Nigerians are still grappling with the recent allocation to the National Assembly for cars and for working conditions, which many Nigerians are frowned at. Why do certain sectors have to understand while certain other sectors don't have to exercise the same kind of patience that others would have to exercise? These are the questions that Nigerians will be asking this morning.
You see, sometimes you hype some issues. In the National Assembly, you forget that this is a major arm of government. And sometimes people think whatever you have in the budget is just for the honorable members just to go and share. Look at the exchequer, like we're saying. What is the budget of the exchequer? At the end of the day, probably you are not getting 100% of the budgeted sum. This happens to every sector too. A budget is just a statement of financial plan. But you get releases based on the availability of fund. What just happened is not a new allocation. It's the number budget that we had. In fact, it was reviewed downwards when we have to do the supplementary budget. So in a supplementary budget, you look at what you have on ground before, then you reallocate money from one area to another. So what we had there was even more than the 70 billion before proposed for expenditure, all things being equal. And I believe that like every other sectors too, money have to be moved from one area to the other so that we can meet up with the present reality. So when you say you have 70 billion naira for the National Assembly, we are talking about the Senate, the reps, the Institute of Legislative and Democratic Studies, the Budget Office, the National Assembly Service Commission, and these are where you have thousands of people working. All their salaries, allowances are all built together. Yes, furnitures, cars, and everything. And you now talk about releases. If you are saying that the National Assembly is saying the money for their own vehicles or their own accommodation or furnitures must be released today, that is where we should be having an issue. But you cannot do the budget when you have the money. You must do the budget when you need to do it. Availability of funds will now determine if releases will be available. And I don't think I will be calling for my own vehicle now if some areas have not been fixed. And you've not had any National Assembly member shouting to say we must have this today. But we must also do our work. We must do it with some equipments too. Just like the doctors are talking, everybody has his own equipment to work with. We do oversight. We move from state to state to do oversight. I'm sure I should not be using my own fund to go around the states to perform our oversight functions. There must be money to be released whenever you need to do some of these things. So these are all what we have in the budget. It's not just one expenditure, one line expenditure. It's the expenditure for the whole year, 12 months. So I want to appeal to us, please, everybody is making sacrifice now. We are saving money now, we are mopping money now, mopping up money. Nobody is spending anything anyhow. You cannot say you've heard of any vehicle bought for anybody within this period. Even in our offices now, you have to bring in your own computer and everything to start work with for now, until everything settles down and we are now able to start purchasing whatever will be required. So yes, government is a continuum, but at least as a new government comes in, you must take stock of what you have on ground and have your own plans. And you know, Asiwaju Bola Ahmed Tinubu is someone who plans ahead. Yes, when you want to plan, it might take you a lot of time, but by the time you have it fixed together, execution will just be seamless. We are going to make Nigeria look like Lagos, where doctors are having a good time, where their salaries are paid on time, where hospitals, you can go to our public hospitals, sometimes you feel you are not in Nigeria.
Mr. Balogun.
Everywhere you get the kind of facility you have in Lagos.
Mr. Balogun.
And it takes time to plan what we have in Lagos.
If you
just
hear
don't
me,
throw money at
thank you
projects.
for your comments so far.
You have to sit together and plan it.
I'm glad you really mentioned that you wouldn't want to take out money out of your pocket to, carry out oversight functions. But I can tell you for free that there are uncountable doctors who have, out of pocket, gotten some equipment to take care of their patients to save a life. But as we wind down the conversation, you have spoken to us about what you want the health workers to do. You should give a bit of more time. Now let's hear what your expectations are for the government to at least meet up with the demands of these people in the short term. Because this is not the first time this thing has started. Years and years back. And they have been disappointed over and again by this same very government who you'll be having a meeting with or do a different administration. So please talk to us about your expectations from the side of the government. How would you want them to handle the situation so that at least in the next 6 months to 1 year, we will not be in the same position as we are right now?
What they are talking about are not something of emergency. Not that we are not paying our salaries. We believe some allowances have to be paid. These are additional issues. Not that salaries are not being paid. Not that basic allowances are not being paid. You want some amendments. You want some review. So you have to sit down and look at these issues. How are they going to be funded? How are they going to be sustained? It is very important. And where we are getting to this front and back is because previous administration, we just want to run away from a problem. Let's just sign something for them. Let's just keep them quiet for a while. Keeping them quiet for a while will no longer work. People are now very sensitive now. People are charged. So it's better you sit down with them. You let them see the situation. When Asiwaju told us on the first day of the assumption of office that in the budget, in the budget, we do have subsidy beyond June. So people said he has removed subsidy. It has been there. It has been removed already. By the passing of the PIA.
Okay.
Subsidy has been removed. But because he was very objective with us, he told us this is the situation.
Yes. Prince Balogun, I'm sure it's a perfect place to anchor this conversation. Thank you so very much for your time. And we wait to see, to hear the outcome of your meeting with the resident doctors. I'm sure you're also aware that NANS had promised to go on strike from 7 days' time, NANS to go on protest rather, 7 days time if the tuition fee is not reversed. You're also aware that NLC will begin a protest in 7 days time, if they don't get all the attention. So many issues before this administration as we speak. We wish you all the very best in your meetings and consultations with all the sectors of government, and we're hoping for the very best. Thank you so very much, Honorable Prince Balogun. It's a pleasure talking with you.
You're welcome.